everybody. Our medical experts are on call to answer your health questions. If you have a health-related question, just email it to greatdayhouston@khou.com. A good smile is universal, and Hollywood banks on million-dollar smiles to fill the box office. So, audience, I want you to help me out with something here. I'm going to show you a celebrity smile, and you just guess who it might be. Let's take a look at the first one. Oh, who is that, do you think? Denzel? No, it's Chris Rock. It is Chris Rock. There you go. That's a big smile right there. All right, this next one here, whose smile could this one be? George Clooney. Oh, you're good. That is George Clooney, man. Yes. All right, let's take a look at a couple of more. This one's like a really big smile here. This is who? Tony Robbins. Yeah, the motivational speaker. Okay, and this next one, the last one here. Oh, that is Austin Powers, baby. Yeah, there we go. Okay. Well, more and more regular men are taking a second look in the mirror and making improvements to keep up with their leading ladies. Please welcome back cosmetic dentist Dr. Terry Alani. Also joining us is Ralph Hunter, one of her patients. Hi.
Hi, Deborah.
Well, Terry, typically, women are the ones that come in and say, oh, I want this, but more and more men are now doing it as well.
Absolutely. Men are really reluctant to go in to the dentist as far as for cosmetic procedures, and that's why in men we see more prevalence of gum disease and oral cancer. But nowadays, because it's so competitive in the workplace, and also just for self-esteem, to boost your confidence, men are now seeking out cosmetic dentistry more than ever before.
Yeah. Now, Ralph, what was the issue with your teeth that was kind of bugging you?
Well, the big thing that was bugging me was that my teeth had started to sag. I had spaces in between them, and it sort of took away my smile.
Yeah. And you also had, see, we're taking a look right there where they're kind of not symmetrical, and then that space in between toward the top there. And then the other thing was that you have a fiance whose teeth were looking really good.
Yeah. You know, her teeth were, she had a beautiful smile.
Yeah.
And I could never smile. And, you know, it looked like she was radiating with more confidence. And so I thought I should look into that.
That's right. You got to keep up with your leading lady there.
And Rob is not bad looking himself.
No, he is not.
When he came in, it was really interesting. I didn't know what his motive was for his cosmetic dentistry, because a lot of times with the men, it's, you know, competitive in the workplace.
Right.
But his was a little bit different. He was competing for that young lady. And so it was really interesting, though, because the before and afters are just amazing. And it really does add a lot more youthfulness to him. And he just really looks
great. And look at that smile. It's kind of one of those, hey there, right? Come hither smiles. All right. So, Terry, there are many ways that people can, you know, improve their smile.
Exactly.
But with veneers, that's probably the most permanent, most natural looking.
Right. What we did on Ralph, we did veneers, and veneers, actually, it's the most conservative procedure for cosmetic dentistry. It is the most natural, and now we also offer veneers where we actually do not have to prepare the teeth at all. It's done in basically 2 visits. With Ralph, we did have to do a little bit of preparation because of the nature of his smile, but they've now perfected a procedure. It's called lumineers.
Wow.
Where they're very thin porcelain facings, and they're actually bonded on to the surface of the teeth, and it's done in 2 visits, and we do not drill. There's no anesthesia, and there's no temporaries.
We love, no drilling, no anesthesia, no temporaries. We love that, yeah. And it can fix a number of problems.
Exactly.
He talked about, you know, them being a little bit crooked and a gap between the teeth, but crooked teeth, discolored enamel, which you saw a picture there, gaps between the teeth, structural damage. Okay, so what we can expect out of those veneers, I know people oftentimes ask me, well, what is it really made of? What's it made of that lasts so long?
It's basically, they're all porcelain. Lumineers is just a specific brand of porcelain. It's a specific lab that makes it, but they're porcelain. Yeah. That's basically it, and they're very thin. What creates the strength is the bond between the veneer and the tooth. And a lot of these before and afters, they're subtle changes, but they make such a big difference. Yeah. And a lot of times your friends won't even notice. They'll just notice that something is different.
Right,
as I say, a beautiful smile speaks when you don't.
Yeah, exactly. All right, so then you come in and then you make the impressions, and so you make sure that you get the perfect fit for your mouth, how your mouth is shaped, and then also picking out the perfect color for you.
Exactly.
A lot of times we think we want bright white, but that's not necessarily what may look good on us.
Well, actually, a lot of people do want white bright now, which is really interesting. But once we place them in, they actually look a little bit more natural. But it's 2 appointments. With lumineers, basically, the patient comes in, we take impressions, send it to the lab. 2 weeks later, that's when we actually bond them on, and that's the work that we actually take to do for the patient. With the porcelain veneers, which you have to do small preparation, the preparation is done on the first visit, and then the second visit isn't so extensive.
Yeah, but then it could last you for the rest of your life conceivably.
Well, you know what I say is, basically, I tell guys, because I have a lot of male patients, and it's interesting, they come in and they're single, and these guys have great jobs and whatever, but their teeth are unattractive, and being the dentist and not in a relationship with these patients romantically, I actually can tell them, listen, why don't you go take care of your teeth? And they really do listen, and I try to do it as a service, and I tell them, you go buy a car, you park it in the garage. You go buy your little toys, you put them aside, but your smile, you take wherever you go.
Right, right. And so when you looked in the mirror and saw the changes...
Oh, it's great. My smile is back.
And he's engaged.
And I'm engaged.
Yeah, love it. Love it, love it, love it. Well, you look fantastic. Terry, thank you very much. We know that you have all kinds of ways to improve our teeth, and veneers is just one of them. Dr. Lonnie has a special offer for Great Day viewers. If you call now and mention Great Day Houston, you can get $1,000 off 4 veneers or more. The offer is good through Friday, so only 1 week to get this great deal. To take advantage of this special, call Dr. Lonnie's office at 713-621-5141, 713-621-5141, or find her on the web at Texastoothlady.com. Also, Dr. Terry Lonnie co-hosts a radio show with her brother, orthopedic surgeon Dr. Wayne Alani, every Tuesday at 1 p.m. on CNN 650. Coming up, Wanda is waving again, but just a few months ago, this simple movement would not have been